Welcome everyone to the statewide adult committee meeting. My name is Kirby Fye. I'm with the department. Just a few things I'd like to go over before we get into attendance. This meeting is being recorded for Governor Lee's Executive Order 78. With that being said, please make sure your phone or your computer are muted if you're not speaking. Otherwise, we get a lot of feedback. Also, if you have any questions or comments throughout the meeting, please state your name before speaking. It's helpful when capturing the minutes. So I'm going to go ahead and go through the attendance, starting with the individuals that joined via WebEx first, since I could see your name, and then we'll go to the individuals who have called in. So like I said, my name is Kirby Fye. I'm with the department. We have Amy Holland, who's also with the department. Allison White. I know Avis Easley's here. She joined via phone with the department. Candice Allen. Ginger Nazary, I know, is joined via phone. Debbie Hillen. Evelyn Jurgen. Jan Cagle. Jeff Flayden. Kara Coleman. Roger Stewart. Samantha Slagle. I'm going to go to the individuals who have called in now. If you could just state your name, please. I know Vonda Wagner, you joined via phone, I believe.
Heather Vestal with TDMHSAS.
Hi, Heather. Heather Vestal. Hi.
Excuse me, I didn't hear you call my name. Monica Knight with TDMHSAS.
Did you say Monica Knight?
Monica V as in Victory Knight, LMSW with TDMHSAS.
Oh, hi. Thank you. Welcome.
Veronica Oach with TDMHSAS as well.
Hi, Veronica. Anyone else I missed that joined via phone? All right, Ginger, I'm going to go ahead and hand it over to you.
Okay, thank you so much, Kirby, and everyone for getting that technology down. I know it's always a challenge. I appreciate you all so very much. And thank everybody for taking time out of your day to join this meeting. I think it's one of the most important things that we do because we get to help influence some decision making at the department, and I appreciate everybody's input as we move through our agenda today. But first on our agenda is NAMI Tennessee, and we have Jeff and Roger from NAMI Tennessee to give us a short presentation of what NAMI is all about and how we can help NAMI and how NAMI can help us. Jeff and Roger?
Thanks, Ginger.
Thank you very much. And I think Roger will be sharing his screen, but I'm going to give a little introduction first of all. First, I always hate hearing a brief presentation because as an executive director, we're taught to never be brief, and I want to warn you about that. But actually, I'll move it along as quickly as I can. I appreciate the chance to be here today. Some of you I've known and met, and there's a couple of people here that have been or are on the NAMI Tennessee board. But for others, some of this hopefully will be new or helpful, or even kind of refocusing, because we know NAMI's there, but how do we work together? So we really love the Policy and Planning Committee, first of all, because it allows people to join together and learn from each other besides the presentations. So we think that that's really great to have that, first of all. But what I want to do really is kind of give the big picture about NAMI. And I'm sure you all know this, but NAMI does not do any direct service. There's no clinical service for NAMI. And it's all about trying to make things better for those impacted by mental illness or mental health conditions, whether that's an individual, a family, or a community. So All those things are important to us. And so we are complementary, I would like to think, with people that do treatment and other services. There is a three levels to NAMI. There's a national organization, there's a state organization, which is NAMI Tennessee, which where we are from, and then there are local affiliates. And local affiliates are around the state. Two of them have staff, NAMI Davidson and NAMI Memphis, and then the rest are 100% volunteers, which we do quite a bit of support for those affiliates to enable them to function. So the national organization, Roger kindly shared our slide. We get programs from them. So you might have heard of Family to Family, which we'll hear about more. And you might have heard of NAMI Basics, which are caregiver programs. We have other programs. So we don't create these curriculum typically, although we have created our own, but we have national programs used around the country. NAMI also does at the national level a lot of advocacy for federal money to come for mental health and things like this. Affiliates are interesting, hopefully, to you because they offer local classes and support groups. And those classes and support groups now mostly are virtual, but some are in person. And it allows for people to experience peer-taught support and education within their community. And we know mental health conditions can be very isolating. So that's just very, very important. We are a membership organization, but people do not need to be a member to participate in any of the NAMI kind of things. We have a statewide convention. Many of you have attended that. The classes and support groups now, they're all free. And because they're over Zoom, it allows people that may have not been able to attend, from their home. And if we don't have a class for quite a while in, let's say, Oak Ridge, if there's one online next week, it makes the waiting period much shorter. And the reason that these things we want you to know about them is because when you're working with people with mental health conditions, you may have access to their caregivers, or some of them may have a lot of support that the caregiver is a big part of their support network. And we strongly believe that caregiver education and support helps to separate the individual from the diagnosis and helps them communicate better, avoid conflict, understand mental illness, all these kind of things. So I'd like to think that that's important for treatment providers. And I know that there's a large variation with how many people are involved with families and where they're not. And I'm going to share that once upon a time, I was a case manager at a community mental health center. And we were taught at that time about the schizophrenic mother. And some of you that are kind of as old as me remember this. And the idea was that the mother would say, "Come here and get away" at the same time. And it created confusion for the child, and that could lead to schizophrenia. And I don't think that's taught anymore. But the idea is sometimes we would kind of blame families, as opposed to thinking of families as being part of supports and part of working toward recovery. And so NAMI began with a couple family members coming together, not much different than Alcoholics Anonymous had two people that drank got together, and then later Al-Anon was family members. And so a similar path with NAMI, where two mothers got together and learned to help each other, and that was before the internet. So let me turn over to Roger now, and he's going to go a little more into some more details on how we do what we do.
Yeah, thanks for letting me join you. Going to tell you a little bit today. COVID has changed so much for us. We do offer support groups for families. Those are almost all statewide right now being offered through virtually. We have 3 different types of support groups that are available, and you can find them on our website. They are support groups for family members, support groups specifically that are peer support groups that are based on the Bridges model. And then we do have some of our support groups where there are only a few people who are getting together that are combined support groups, both family members and individuals with mental health conditions joining those support groups together. Each one of our support groups is described on the NAMI Tennessee website, www.namitn.org. It has really been neat. Some of the things we jokingly say, the Zoom giveth and the Zoom taketh away, because our support groups now, it really, the primary thing that matters is not geography, it's Eastern time or Central time. People can join any support group that they want to and participate by contacting the facilitator. It's been wonderful to be able to have families who live hours and hours apart from each other to be able to participate in support groups together. Also want to tell you a little bit about the NAMI Tennessee Helpline, where we provide resources. We are a self-help line in which we provide resources for people to be able to reach out and navigate the mental health system. Also, our local affiliates offer those same types of services because they're very familiar with the mental health services in their community, who's providing what and how to access them. Jeff has already talked to you a little bit about our education classes. I want to tell you just a little bit about all of them. They are all taught by volunteers. They are all free. They are all peer taught. And right now, currently, they are all on being offered virtually. We have a number of different programs that we are offering. The Family to Family program is for individuals who have a loved one, a family member, somebody they care about, who is an adult with a mental health condition, and they want to develop coping skills or helping skills. We also offer the NAMI Basics class. Basics is for primary care providers, can be anybody who is essential in the life of a child who has a mental health condition or co-occurring substance abuse disorders. We have all kinds of grandparents, aunts, uncles, mom's best friend, anybody who's essential in the life of a child who wants to assist, who takes that class that's based on Family to Family. It also offers coping skills and helping skills. NAMI Homefront is a program for the families of veterans and active duty military personnel. This is a nationwide class. It is a synchronous class. Everybody gets together depending on the time zone at a specific time on a specific date and participates in a web-based class together to learn about the special needs of families that are involved with military service. The In Our Own Voice program is a public speaking program. Everybody's got a story to tell, and but not everybody knows the best way to tell that story. So NAMI has created this program that applies a specific template to help people tell their story in the most powerful way. It is for individuals with mental health conditions that don't have to be diagnosed. They just have to be in recovery and be able to tell their story of recovery and their hopes for the future. It's a very strong anti-stigma program. Similar to be the same thing can be said of Ending the Silence. Ending the Silence is a program that is an anti-stigma program. Two presenters do this program for middle school and high school age students. It is age-appropriate material that provides information about mental health conditions, about the prevalence, and most of all, how you can be a friend and how you can help somebody in their time of need. The last program that we're going to talk about is our newest program that we've brought online. It's Family and Friends, and it is a 1.5 hour program that provides the very basic fundamental information that family members need to know. It's offered most of the time. Most people who take this brief introduction to family are doing so in a time of crisis, and it provides fundamental information, coping skills. It's very much based around providing crisis coping skills. And those are most of the programs that we offer. Jeff, mental health and criminal justice.
Well, I want to say one thing too about In Our Own Voice, which may be of interest in your local communities. So often I hear within, for instance, a mental health center, you don't see a lot of the people doing well. And In Our Own Voice is somebody that has a mental health condition that now can come and talk about their journey of recovery. And actually, two people come in as a pair, and it could be a good staff training. But another thing is, if you're working with somebody and they find recovery and they've decided, I want to help other people, but they're not ready to make it a career, like to be a CPRS or to go back to school, but they want to help to kind of spread what they've learned. This is a great opportunity. And Roger, do you recall how long someone needs to be in recovery before they might be a good candidate to present In Our Own Voice?
If I remember the specifics correctly, they have to be in recovery for 1 year.
Okay, so that's a program where we're seeking referrals. All these programs, they work if people are exposed to them. And so we hope that through collaboration with other organizations and through the adult committee, different ways that we can let people know about these things. And what I feel good about is, we're not trying to take anybody's client away. It's complementary. So
we're looking for two types of referrals concerning In Our Own Voice. We're looking for individuals who are in recovery who want to share their story of recovery. We're also looking for presentation locations, places where people need to hear those stories. So we would appreciate any referrals that you could have for that.
Absolutely. We've been doing a lot of more work lately with mental health and criminal justice, and I see people on the call that have been part of that. That we are working to expand CIT throughout Tennessee, and we've received state and federal funding in order to do that, and we're trying to work really everywhere. We have a statewide CIT task force. If you're working with CIT and you're not involved with that, contact Roger or I, and we'll get you connected. We're promoting best practices, so we're now just have begun to try to bring CIT coordinators together. We are also working with Mental Health First Aid in partnership with Mental Health America of Middle Tennessee to bring more mental health first aid into that. And we're also learning more about co-response models and how we might assist communities with that. We're working with Tennessee Bureau of Investigation now and Highway Patrol and many, many communities throughout the state. So that's on that one. And advocacy, many of you may have heard of our Days on the Hill. Instead of our One Day on the Hill, we had a series, and that's up there online still to watch. And we had various special topics about talking to legislators, about sharing your story. We had one focused on youth and young adults. We had one focused on minority and diversity advocacy. But we also have calls for action, and we sit with other organizations and help to lead or participate in coalitions like the Pre-Arrest Diversion Coalition that got money for the walk-in centers, the Mental Health and Substance Abuse Coalition, and we've been active with parity legislation and other legislation, and so that's important. You might wonder how we're funded. We since we do all these things for free, we do get funding from the Department of Mental Health and Substance Abuse Services. We're very grateful for that. We have grants, we have sponsorship opportunities around the convention, and NAMI Walks and Vision of Hope Gala are listed there. There's two NAMI walks in Tennessee. There's the NAMI Davidson Walk, which is right around the corner. And then there's NAMI Walks Tennessee, which used to meet in Knoxville and have a big walk, but now it's virtual. So it's walk your way in your community. And I'll just mention with the walks, it's a good idea. I mean, a good way for your staffs if you want to give a visible to the community outside your walls demonstration of mental health awareness and interest in bringing attention. Maine Mental Health Month, or right now with NAMI Davidson, those are great opportunities. And the gala we do every year, it's during Mental Health Month, and we're very excited about that. So that's really. Oh, there's one other thing that's not on the slide. We've really tried to add with COVID a whole lot around mental health awareness. So we have a weekly NAMI Facebook Live series, and we've had many speakers. It's every Monday at 2 p.m. Commissioner Williams spoke recently on it, and we are always looking for expert presenters on any kind of topic related to mental health. So those are available. Our NAMI at home emails, if you've seen those, if you have a crisis number that's not on our list or an important number that you know about, we have emergency and support phone numbers, and we have every week a different focus on from trauma to eating disorders to what is bipolar to caregivers. So we do hope that people see that and encourage subscription to that. And that's pretty much it. Hopefully it wasn't too long, and if there's any time, we'll be happy to answer any questions.
Thanks, Jeff. Thanks, Roger.
Thanks so much.
Well, thank you. Hopefully something new, but just to keep us in mind when these things will help, it is, you know, our wish.
Ginger? I'm not sure. No, she's there. Candice?
They may be muted. I'm here.
Okay. Okay. I don't know where Ginger's at. She might be on mute. Let's see.
She can hear us.
Yeah. Sorry, guys. Okay. I'm not sure.
She had trouble last time.
I know WebEx has been interesting the past 2 days.
Can you hear me now?
Yes,
There
we
she
can hear you now.
is. I was trying to look up the agenda. Okay.
Look, I know Ginger's there and she's probably talking and we can't hear her.
I was. I was just talking right away, and I wanted to thank Jeff and Roger. I think they did a great job on staying on task. After Jeff said he might go long, I think he did a super job. But I did want to ask, once some of the COVID restrictions are done, are y'all anticipating that you'll still have Zoom meetings and Zoom classes for people to join?
We are anticipating that we will have a mix. We've got so many people who are participating virtually that we will continue to have some classes and some support groups that are available virtually, as well as our in-person meetings and classes. Yeah. I don't think there's any going back to completely the way things were before.
Mm-hmm.
Yeah, I don't think we can put the toothpaste back in the tube. Do you?
No, and like I say, in so many ways, that can be the best of both worlds. You know, we've got people who are able to participate virtually in our classes and support groups that were not able to ever, do those things before. We had a class not too long ago in which we had members of the same family participating from Upper East Tennessee, from Chattanooga, and from Georgia. And that would have been an impossibility for those family members to be together in a class before we went virtual.
Amazing. That's awesome.
Yeah.
Well, thank you both again for taking out time of your busy day. I know you guys have tons that you do. I saw firsthand the development of the strategic plan, and NAMI's got some great things coming, guys. So we want to keep our eyes open and our ears tuned in, because they have some great things coming forward. And we appreciate everything you do to support the community. And you are more than welcome to stay for the rest of the committee, or if you need to go, we understand that as well. So thank you both.
Thank you, Ginger.
Thank you. I'm gonna go, but I want to leave one parting thought that I forgot to mention. Some people may think that they're not welcome at NAMI if they work in the field, and they may not have a mental health condition, and they may not be a caregiver. But all we really require is that you have an interest in mental health. And some of our more rural affiliates have a challenge to have the critical mass of volunteers to keep it running. So I would put out that call that please feel free and welcome if you want to connect with your local NAMI affiliate. I'm sure they would like to have you, and we would be happy to help you with an introduction if that would be of interest. Just you could reach out to Roger or I, or you can email us also at info@namitn.org. If you don't have our names or emails handy, info@namitn.org, and we'd be happy to help facilitate that. We have guest speakers at affiliates as well. Yeah, thank you. I'm going to go so I don't take more of your time.
Okay.
Thank you. Bye.
Okay. Have a great day. Thanks.
Thank you.
So, thank you. Moving along our agenda, we were going to finalize our needs assessment, which is due tomorrow. So Avis and Kirby can be proud of us if we can get it done today.
Proud of you anyway.
Are y'all able to hear me now?
Yes.
Okay. For some reason, it's automatically muting me. I don't know. Anyway, so I think if you look at your reminder email from Kirby yesterday, she sent out the needs assessment, and we do need to go over this one more time, make sure everybody's okay with it, and then we can ask to have it submitted. So, Candice, what should we do? Just read these out and go through them one at a time?
Ginger, I think that's good. I think that's fine. I think just mainly if we just go through, maybe just read the needs.
Okay.
The needs section instead of all the data.
Okay. So for our mental health need, the first one we identified was establish transitional housing respite services to aid homeless or potential homeless individuals with mental health disorders being discharged from hospitals, EDs, and jails to prevent readmission or recidivism, and allow these individuals time to complete tasks and obtain permanent housing before discharge. Additionally, kind of snuck a lot in there, establish permanent housing opportunities with the emphasis being placed on service provision to support individuals who may need some supervision and support to live successfully in permanent housing, but do not require the level of care to meet medical necessity for supported living in residence, i.e. group homes. This may offer an alternative level of care to support those nearing readiness to leave group home setting, but not quite ready for living in an apartment or housing alone, thereby creating more openings in supported living facilities. So that was our one goal that we identified, and we talked a little bit about in our data that our great Chi 1 and Chi 2 teams have developed last year 2,541 housing opportunities, but we still, according to the point in time, have over 7,000 people experiencing homelessness in our state. And so if we can create some more opportunities for housing, then hopefully we can avoid some of that for people. So are there any comments or worries or suggestions about that need? Kirby,
No.
it was kind of short. It's kind of short on data. Sorry. I'm not sure what
I
else
think
I can.
it has good data.
Okay. Okay. So then our second need that we identified, and some of these were kind of repeats from last year, and I think we all understand that COVID kind of impacted this. Enhance our workforce development that will allow providers to obtain and retain psychiatric providers and licensed therapists, particularly clinicians who serve individuals insured by Medicare, in order to provide effective services and meet the needs of the community. Ensuring salaries that will attract students and keep the experience in the field is essential. And we referred back to some data from TAMHO last year, and I think that's pretty much all we could add to that right now. So any comments about the second mental health need?
This is
Ginger, can you hear
Jan.
me? Yes, Jan?
So one of the things that Region 2 had talked about, Candice, you may want to chime in, is that I think we're going to present the same thing, but also include some requests for like special needs, workforce development for people with hearing impairments, intellectual developmental disabilities, because
so
those
kind
are,
of
well, staffing for those special needs.
yeah,
Okay.
yeah. I think that's great. And even perinatal care, with the eating disorder. We have a lot of special needs, I think, that we could focus on. But gosh, we got to get regular people in there so we can help them get special needs.
Absolutely.
So,
Thanks.
thank you, Jan.
I wish there was some way to, this is Candice, that we could include, I keep saying this, that we're losing people to Burger King. That's how bad it is.
Yeah. Oh, I know.
They pay better.
Yeah.
And less stress.
Yeah.
Yeah. So, well, maybe we'll just leave this one since Region 2 is adding that, and then that may increase the pressure to include it more in the 3-year plan. So moving to our substance use disorder need for 2021, increased recovery housing to include peer recovery residents, halfway house and 3-quarter houses, and increased education regarding recovery housing to treatment professionals, community members, and recipients. And we're very proud that the Oxford House models continue to grow across the state. According to the directory, there's 137 Oxford houses, which can house 6 to 12 people. However, especially in our rural areas, we continue to have deserts, and we all know about NIMBY, so hopefully we'll need to work on some education in communities. So I think, were there any comments or to add to that one right now? Okay. And then the other needs we identified. Yes, ma'am.
Can you hear me? This is Avis.
Yes. Hey, Avis.
Hi. I was just going to say that for anybody on the phone that may be having trouble, because you have to push *6 to unmute yourself and make sure that you can talk. Somebody might be having trouble with that, so I just want to throw that out there if anybody on the call is trying to comment.
Thank you, Avis.
You're welcome.
Okay, so we'll move to our second substance use disorder need, is to increase educational opportunities for clinicians, health counselors, educators, communities, faith-based organization, and business partners surrounding the prevalence, impact, and resources regarding harm reduction, recovery, and reducing the stigma. And the COVID pandemic has limited our ability to get out in the community with education. And we still have a pretty high overdose rate, so obviously that need is still there. So hopefully we can implement some changes there with recommending this need, identifying this need. So I guess I'll leave it open for any comments from anybody on the phone or on the WebEx.
This is Candice. I think it looks really good. Thank you for putting that together.
You're welcome. I appreciate everybody's input in the last couple meetings that we've had. This is not a one-person thing, for sure. And Jeannie Price, the statewide regional housing facilitator, helped me with some of the numbers. And if you've not met or talked to your local regional housing facilitators, they're pretty amazing people. I'd encourage you to get out there and meet them if you can. Well, that being all said, Kirby, do I need to reformat this in any way to be able to turn it in, or can I just give it to
No.
you? Can you take it
This
from
is
here?
it. This is good to go.
Yay, I'm so excited.
Every year Ginger gets worried that she's going to be late and miss the deadline, and every year she makes the deadline.
I'm so excited.
No, this looks good.
Okay, great. Well, I would like to ask the committee for a little help, and if I could, Kirby. Candice and I need some help with ideas for what you guys would like to hear about in our next couple of meetings. If there's a particular program or a particular issue that you would like us to seek out a speaker for the next couple of programs, that would be really, really super helpful. So anybody have any ideas or concern areas?
This is Jan. I'm going to have to think on that.
Thanks, Jan. I appreciate it.
And if any of the committee members, if you have a program going on with your agency and you would like to present, you can do that as well. You can reach out to me or Candice or Ginger with any ideas. Even if you don't have a presenter in mind, but you have a topic in mind, we'll find somebody.
We really appreciate the help. It's kind of like planning a party and not having a theme. So it's a little bit easier if you know it's going to be a mermaid party.
Right.
Or what.
Also, if there's anyone that is joining the call that has a topic that from their agency, a program or a service or something that you want the committee to know about, excuse me, that's another opportunity too that you can contact Kirby or Ginger or Candice and let us know that you want to share some information from your agency.
Hey everybody, this is Kurt. I have a topic. Maybe Kirby can just do a picture slideshow of her new daughter for the next meeting. I'm sure she has enough pictures
I do have some photos,
yes.
everyone.
Yay.
I'm gonna hold on. I think I have one on my desktop. I mean, I know I do. Hold on.
You'll have to send me a text, Kirby, because I can't see it.
We are definitely excited to have Kirby back, and as I told Kirby yesterday, I said your daughter, her name is Dylan. She is absolutely beautiful, and I told her Dylan is an honorary member of the planning team. She has full range of anything she wants to do in the office of planning. And
She's beautiful.
She's a button.
I had the pleasure of seeing her yesterday virtually, since we're not together in the office there, and so I had an opportunity to see her virtual, and she is absolutely beautiful. So congratulations again to Kirby, and we are excited that she is back with us, because Kirby brings a lot of joy to the Office of Planning and expertise. So we're just excited to have her back. And now a baby. That's a junior planning team member. Yes.
Thank you for the kind words, Avis.
Glad you're back, Kirby.
Thank you.
Well, I guess if you're in East Tennessee, if we adjourn a few minutes early, that will give you a chance to have a little bit longer lunch break. If you're in Middle or West Tennessee, I guess this gives you time to go get another cup of coffee before your lunch. But again, I do want to thank everybody for attending and for your participation and throwing out ideas. We will look forward to some ideas, please, and hopefully y'all can send those to us. I'm sorry, Kirby, can you remind us when the next meeting is? Is it in July?
Yes, it's July. Let me get the exact date. July 14th.
July 14th. So we'll see you all then, and please, everybody, have a safe. There's still some COVID numbers going back up, so please be safe out there and stay healthy and have a happy spring. Thank you. Bye-bye.
Thank you. You too. Bye-bye.
Bye.
Bye. Thanks, everybody. Bye.
Bye.